You mentioned about the importance of having expertise before you start making judgments about treatments. What is required before someone is considered an expert or someone who is suitably qualified to give out medical advice?
Okay, so I think a good way to answer that would be to explain, what is involved in medical training and the training, to become an expert in a certain field. So the basic medical degree is the MBBS, and you have to do science subjects at A-level to start that. And then in medical school, you actually study a number of separate disciplines or separate subjects within that. So, for example, you study anatomy, which is the structure of the body. You study physiology, which is how the body works. Biochemistry, which is the chemical processes in the cells and so on, and the body. Pharmacology, which is how drugs work. Pathology, which is how diseases work in the body. Immunology is how the body fights back. So that's a whole sort of series of subjects you have to gain competence in. Then the clinical part of the work is where you actually go to hospitals or clinics or operating theatres and you see how medicine works day to day with patients. You learn how to examine patients, how to take a history, asking about what their symptoms and problems are, and so on. And then you also have a whole host of exams and assessments and practical exams. So it's quite a rigorous process. Once you've done that, then you've got your basic medical degree, and even that is just a very first step. And then you have to go through a number of years of training, maybe 7, 10, maybe more years of training, the postgraduate training. And if you like, that's a kind of apprenticeship where you work, but you're closely supervised by more senior doctors and who check you and monitor you and test you. And you go through these, you also have assessments, you have exams, and you go through these years of experience, and then eventually you will get that subspeciality training or competence in that area of medicine. And there are many specialities and subspecialties within medicine, like surgery, general medicine, family medicine, other types of surgery, cardiology, oncology for cancer, ophthalmology for eyes, radiology for imaging, and so on. So you will then get your competence and your training, and you'll be allowed to then practice independently, as it were, in that area. It's important as well to understand that there's two issues. One is, you asked about giving advice. So, yes, you do need the knowledge and expertise and experience to give advice, but it's even more stringent when it comes to actually making a specific advice to a patient. That patient comes to you with certain problems and said, I have X, Y, and Z, what's the matter with me? You have to go through a process of diagnosing the patient and then advising and then treating the patient. And that is, it requires much more experience and knowledge and know-how to do that. So that should be borne in mind. I think you can contrast that with other types of studying or other types of doctors or expertise, which is there's no doubt. So if you take, for example, someone who's got a PhD in a particular science, so out of those subjects I mentioned, they might be interested in anatomy, or they might be interested in biochemistry or pharmacology. So in that one subject they'll go in more depth, and they might do research in a very small part of that, and in that small area they'll be world experts, there's no doubt about that. But that doesn't give them that global training or that global knowledge base, and they've not gone through those years of actual practical experience and training and vetting in order to be able to treat patients. So it's a completely different scenario. When I talk about this, the kind of rigorous training that doctors have to go through to become a doctor and to specialize, the purpose is not to say, right, we're doctors, we know this, we know our stuff, and you have to listen to us and that kind of thing. That's not the point. That's not the point. The point is to realize, and there's a nice saying in Arabic, which if you translate, that as you increase in knowledge, you increase in humility. And I think that's what happens, and that's what you see, that as you have more knowledge, medical knowledge, experience and expertise within medicine, within your field, you actually become more careful and cautious and and you're very careful to stay within the bounds of your knowledge. That's really important. And if you actually work in any kind of medical situation, whether it's in hospitals or clinics or whatever, you will see that this is how doctors work, that they will stick to their knowledge, they will stick to their expertise, and they won't go beyond that. And if there is a problem outside their field, they will go to another expert, another specialist, and they will get their help. And that's how we work as doctors, safely together in teams to bring out the best outcome for the patient. It is no longer at all possible for one person or one doctor to be an expert in all fields, to be an expert in vaccinology, immunology, cancer medicine, cardiology. It's simply not possible, and it's not safe to do that. Rather, doctors, they work together in teams, and this is how we work. Now, to give you an example of that, I work in a major cancer center, and this is how we work. We have teams of doctors. We have a multidisciplinary team meeting twice a week, where we have doctors from all the different specialities: cancer, radiation oncology, radiology, pathology, and so on. And we sit together. We give, for each patient, we'll give our assessment from different angles, and then together we'll make a collective decision that this treatment plan or these two options are the best for the patient. And then we will take it to the patient and then discuss with them and see if they want to go ahead with that. So that's how medicine works, and that's how medicine works in a way that is safe and is best for the patient.